Today, we are going to take up a lesson on steps of planning of health education program. So now, introduction. A health education program may be focused both on the individual and society. However, contemporary approaches to health education recognize the importance of various contributions, including concern for the role of society. This perspective recognizes that factors such as income, housing, cultural practices, and the like shape a person's health potential. WHO's targets for health for all recognizes that there are limits to the choices open to individuals, that is, limit imposed by their physical, social, and cultural environments and by their financial means. Planning is one of the most important project management and time management techniques. Planning is preparing a sequence of action steps to achieve some specific goal. It is a process of setting goals, developing strategies, and outlining tasks and schedules to accomplish the goals. If we do it effectively, one can reduce the necessary time and effort of achieving the goal. A plan is like a map. When following a plan, we can always see how much we have progressed towards project goal and how far we are from our destination. Knowing our position is essential for making good decisions on where to go or what to do next. Strategic planning provides a roadmap and directions on how to get there. It is used to guide all decisions. Planning is a continuous process. It is a series of decisions from general strategic decisions based on the collection to analysis of a wide range of information. Careful planning is essential to the success of all health education programs. Planning is deciding in advance what to do, how to do, and who will do it. Planning bridges the gap between where we are and where we want to go. It makes possible things to occur which would not otherwise occur. Planning can be thought of a cycle that has 6 steps. Thus, a planning may be defined as a map, as preparation, as an arrangement. It directs where one wants to go and how to get there and the timetable for the journey. Planning can also identify the journey's milestones. Complete planning set out indicators for tracking progress and way to measure the progress. After this, we have need for planning. Planning plays an important role in health education. It involves a systematic framework for the proper implementation and promotion of health program. Number 1, to get the desired endpoint right from the very beginning. Number 2, to direct resources to where they will have the greatest impact. Number 3, to ensure the development and implementation of the effective and appropriate health promotion programming. Further, following points are to be kept orderly in mind while planning. That is, number 1, defining community health problems. Number 2, identifying unmet needs. Number 3, surveying resources to meet them. Number 4, establishing priority goals that are realistic and feasible. Number 5, projecting administrative action to accomplish the purpose of proposed program. So now we have initiative of health planning. The health planning process occurs within the health services sector, usually initiated by government or bodies delegated by government to manage health resources in an area, such as a regional health authority and local health integration network, which are designated to manage local health planning efforts. A health planning process may also be led by service providers such as mental health agencies, hospitals, public health agencies, and other service providers to help them define future roles or immediate service goals. Professional associations may also establish planning processes to address area of interest. After this, we have principles of planning in health education. There are 6 important principles of planning in health education. They are: number 1, it is important that plans are made with needs and contexts of the community in mind. One should try to understand what is currently happening in the community that he works in. Number 2, consider the basic needs and interests of the community. If the person does not consider the local needs and interests, then the plan will not be effective. Number 3, plan with the people involved in the implementation of an activity. If the plan includes people, they will more likely participate and the plan will more likely succeed. Number 4, identify and use all relevant community resources. Number 5, planning should be flexible, not rigid. It can also be modified when necessary. Number 6, the plan activity should be achievable and take into consideration the financial, personnel, and time constraint on the resources available. So, one should not plan unachievable activities. So now we have steps of planning. At its core, health planning follows the same basic steps that any planning process follows. In health planning, these steps constitute a cycle that is normally repeated in terms of planning for program, systems, populations, or health goals. Generally, there are 6 different steps in planning. These include step 1, that is assess need. Step 2, that is identify and prioritize. Step 3, that is set goals and objectives. Step 4, that is develop strategy. Step 5, that is implementation. Step 6, that is monitor and evaluate. Now we have step 1, that is assess need. In this, we have number 1, identify existing and needed resources to conduct assessments. Number 2, identify educators to participate in the assessment process. Number 3, apply theories and model to develop assessment strategies. Number 4, develop plans for data collection, analysis, and interpretation. Number 5, engage educator to participate in the assessment process. Number 6, integrate research design, methods, and instrument into assessment plan. Number 7, identify emerging health education needs. Number 8, report assessment findings. After this, we have step 2, that is identify and prioritize. In this, number 1, incorporate principles of community organization. Number 2, identify priority populations. Number 3, communicate need for health education to priority population and the educators. Number 4, develop collaborative efforts among priority population and the educators. Number 5, elicit input from priority populations. Number 6, obtain commitment from priority populations. Then we have step 3, that is set goals and objectives. For this, we have number 1, use assessment results to inform the planning process. Number 2, identify desired outcomes utilizing the NEAT assessment results. Number 3, select planning models for health education. Number 4, develop goal statement. Number 5, formulate specific, measurable, attainable, realistic, and time-sensitive objectives. Number 6, assess resources needed to achieve objectives. So now we have step 4, that is develop strategy. Number 1, assess efficacy of various strategies to ensure consistency with objectives. Number 2, design theory-based strategy and interventions to achieve stated objectives. Number 3, select a variety of strategies and interventions to achieve stated objectives. Number 4, comply with legal and ethical principles in designing strategies and interventions. Number 5, apply principles of cultural competence in selecting and designing strategies and interventions. Number 6, pilot test strategies and interventions. After this, step 5, that is implementation. In this also we have number 1, assess readiness for implementation. Number 2, collect baseline data. Number 3, use strategies to ensure cultural competence in implementing health education plans. Number 4, use a variety of strategies to deliver a plan of action. Number 5, promote plan of action. Number 6, apply theories and models of implementation. Number 7, launch plan of action. Number 8, monitor implementation of health education. Number 9, monitor progress in accordance with timeline. Number 10, assess progress in achieving objectives. Number 11, modify plan of action as needed. Number 12, monitor use of resources. Number 13, monitor compliance with legal and ethical principles. Number 14, train individuals involved in implementation of health education. Number 15, select training participant needed for implementation. Number 16, identify training needs. Number 17, develop training objectives. Number 18, create training using best practices. Number 19, demonstrate a wide range of training strategies. Number 20, deliver training. Number 21, evaluate training. And number 22, use evaluation findings to plan future training. After this, we have step 6, that is monitor and evaluate. For this, number 1, create purpose statement. Number 2, develop evaluation and research questions. Number 3, assess feasibility of conducting evaluation and research. Number 4, critique evaluation and research methods and finding found in the related literature. Number 5, synthesize information found in the literature. Number 6, assess the merit and limitation of qualitative and quantitative data collection for evaluation and research. Number 7, identify existing data collection instruments. Number 8, critiques existing data collection instruments for evaluation and research. Number 9, create a logic model to guide the evaluation process. Number 10, develop data analysis plan for evaluation and research. Number 11, apply ethical standards in developing the evaluation and research plan. So now we have strategic planning process components. Within any strategic planning exercise, the following activities will occur. Number 1, a visioning exercise. Number 2, creating mission and goals. Number 3, establishing objectives. Number 4, establishing strategic direction. Number 5, developing a framework to establish and monitor success. That is a balanced scorecard approach, for instance. Number 6, creating an implementation plan and timetable. After this, we have types of planning, health education. Health planning includes several specific types of planning. They are: number 1, health system planning. Number 2, health goals planning. Number 3, health services planning. Number 4, population health planning. So now we have health system planning. The system itself is usually planned at the provincial government level and by provincial agents such as regional health boards. A well-organized and functioning system of health services is like the connectivity of the human body system. There are two essential phases of health system planning. They are: number A, design and system development phase. Number B, implementation of the system management and operation components. After this, we have health goals planning. These had varying levels of success but were important in engaging municipal, government and providers groups as well as citizens in discussion of the broader determinants of health. These goals can be considered part of any local health system planning exercise and will offer a macro framework for health goals and how to establish and report on them. After this, we have health services planning. Health services planning relate to a specific type of service or sector. For example, mental health service delivery. This type of planning can be undertaken by government or developed to providers. The mental health implementation task forces convened across Ontario in 2002 and 2003 are a good example of taking a specific sectorial approach to service planning. It represented a combined planning effort on the part of government, providers and client advocacy groups. After this, we have population health planning. The population health concept is commonly used as tool for public health and for other interested in health promotion activities. Population health starts from the premises of understanding and then improving the health status of a particular population or the population of a community as a whole. Strategic planning for population health usually focuses on macro issue identification and related strategy development. Now, conclusion. Planning in health education comprises a range of activities that share the goal of improving health outcomes or improving the efficiency of health services provision or both. A solid and well-designed health planning process will be resilient enough to accommodate the society and to use them as lever to go forward and solutions for improved healthcare provision and health outcomes in the population of a particular society.